Hello everyone, I'm Dr. Rakhee, consultant pediatrician. Today I'll be answering some frequently asked questions by parents and the general public about influenza, an infectious disease that is also known as the flu.
How is influenza different from the common cold and COVID-19?
Some people may use influenza or flu interchangeably with cold, but this is a common misconception since their symptoms may appear very similar. This is the same as COVID-19 as well. All three are viral respiratory illnesses that cause symptoms such as fever, cough, sore throat, body aches, headaches, and fatigue. Hence, it can be difficult to differentiate between influenza, the common cold, and COVID-19 based on just symptoms only. The main difference between the three conditions is the cause. Influenza is caused by influenza viruses, while the common cold is caused by various other viruses such as RSV, the respiratory syncytial virus, rhinoviruses, and parainfluenza. Even though both influenza and the common cold may appear similar, influenza symptoms are generally more intense and occur more abruptly compared to the common cold. There's also a higher chance of developing severe complications due to influenza than the common cold, but the only sure way to confirm whether you have influenza, colds, or COVID-19 is to get yourself tested.
When is the influenza season and when should we get vaccinated?
We often hear about the influenza season when there is a surge of influenza cases during the year. In regions with temperate climates, influenza season tends to happen during winter. This applies to both the northern and the southern hemisphere. However, in tropical regions such as Malaysia, there is no regular influenza season, and influenza may occur throughout the year. Hence, we should be cautious all year round as an outbreak may happen anytime. Vaccination is one of the primary measures of precaution to protect us against influenza. Everyone aged 6 months and older are recommended to get the influenza vaccine annually. For children below 9 years old who are taking the vaccine for the first time, 2 doses are required, in which the second dose is given 4 weeks after the first dose. So get the vaccine before influenza begins spreading in your community, since it takes about 2 weeks after vaccination for antibodies to develop in the body. The influenza vaccine is also recommended before traveling to countries with temperate climates during winter.
What are the benefits of influenza vaccination?
As mentioned just now, vaccination is the best way to protect ourselves against influenza. By getting the influenza vaccine, your chance of getting infected is reduced significantly. It also reduces medical visits, hospitalizations, and death due to influenza. Even if you are infected, you're less likely to suffer from severe symptoms and complications. In addition to that, getting vaccinated also protects people around you, including those who are more vulnerable to serious illness, like babies, young children, older people, pregnant women, and people with certain chronic health conditions or a weakened immune system. You're less likely to transmit the infection to these group of people if you're vaccinated.